Hi, and welcome to Hiss and Tell, a podcast about cat behavior and all things cat related. I'm your host, Christina Wilson, professional animal behaviorist. Today's guest is Dr. Gina Rendon, veterinarian from Williamsburg Veterinary Hospital. We're going to discuss FIP, feline veterin. Today's guest is Dr. Gina Rendon of Williamsburg Vets. We'll be discussing FIP, feline infectious peritonitis, and also answering some of your questions. Tune in. Welcome to another episode of Hiss and Tell. I am your host, Christina Wilson, and with me again today is the lovely Dr. Gina Rendon of Williamsburg Vets. Yay.
Yay.
I don't know why I always clap when you're on. I always clap. I'm such a moron. Okay. Today's topic is FIP, which is feline infectious peritonitis. I don't know a whole lot about this topic, which is why Dr. Rendon is here to tell us all about it. So let's just kick off. Dr. Rendon, what is FIP? Tell us all about it.
Well, the reason that we're doing this podcast, I'd like to say, is that the last one that we did together, somebody had a question about FIP. And there are so many things happening with FIP that I did feel like it was worth it to do a whole podcast to talk about how things are changing. But so FIP, feline infectious peritonitis, is actually, it's a coronavirus, which I think we should all be very familiar with because of COVID. They're not the same, they're distantly related, so people don't have to worry about any kind of transfer from cats to humans and humans to cats. That's a different thing. But so the interesting thing about FIP is that it actually is a mutation of a much more common coronavirus. It's feline coronavirus, but it's something that actually usually affects their gut. And it's something that is ubiquitous. You see it everywhere. It's very common. It's most common in groups of cats, so multiple cat households, rescue places, shelters, catteries, that type of a thing. And it's passed through the gut. It's a fecal-oral transmission, which means this is a virus that lives in cells in the gut. And then when cats have it, if they are shedding and then they're cleaning themselves, or if a mother cat is if they're cleaning each other, allogrooming, then it can get passed around. So very, very common. Rarely does it cause any major issues. Sometimes you'll have a kitten that has diarrhea, but it tends to be something that they can clear pretty effectively. It's interesting because it's something that they can clear and then get reinfected and clear and get reinfected. And so kind of like with COVID, it's something that's out there and it changes a lot. So FIP is that virus that then within the animal, and we don't know why, it can mutate into something that's much more virulent. And so where it originally is a virus that lives in the gut cells, it then changes and becomes much more friendly to cells that are white blood cells. And so monocytes and macrophages, it'll start to invade those cells. And those are white blood cells that grow through the entire body. And so then it can become a systemic illness. And that is a very virulent disease. And it's tragic. Cats that are most at risk are cats that are from multi-cat groups. So again, what I was describing, the youngest cats are the most susceptible to having the initial, the more benign version. And there's a possibility that the cats that have been exposed the most as kittens may be more at risk for developing it later. But it's something that you can't really predict if it's going to happen. Once it does happen, it can affect any part of the body. And so that's the part that gets a little bit hard. And it's been around for, I think it was first recognized like in the 60s or something like that. But every veterinarian who has worked with cats has seen FIP. And it used to be deadly. Cats would die from it. And it was just incredibly depressing. So young cats, usually less than 2 years old, it affects male cats more. It affects purebreds more. And then if they've been in a situation where they've been around a lot of other cats, and there is evidence that stressful events can make this more likely to be to mutate. And so with cats and stress, I think that's a whole new podcast. But there are a lot of potential things that can act as stressors and triggers. But once it has mutated, then it's a big deal. I'm going to let you ask questions as we go, because otherwise I'm just going to yammer
No, I
and
mean,
just keep talking.
you're not yammering. You're the one who knows stuff. I don't know
Yeah,
anything
anything.
about this, and I'm just going to ask dumb questions,
Okay,
So
okay,
please continue.
okay. So the common presentation for cats that have FIP, usually it'll be a young cat that comes in
Hmm.
and is sick, and it can be that they're lethargic, that they're not eating, they can have a fever. And when I was preparing for this, I was actually thinking about Eugene because,
Right,
Eugene is one of your babies who had a terrible fever. And so not every fever is FIP, and
right.
young cats can have viruses that will cause fevers. Cats are really good at doing fevers, and so they can have really high fevers. FIP is not one that you necessarily will see really high fevers with, but it is one of the things that they can get. There are classic presentations of FIP that are easy to diagnose, or just a little bit more what you would expect for FIP.
Hmm.
And those symptoms would be they often develop fluid in their abdomen, so something called effusion. They can have the fever, blood work changes. Usually they'll have elevations in globulin levels, liver values. Cats can come in jaundice, so they can be a little bit yellow looking. And so for those cases, if you look at, you know, the age of the cat, the type of cat, and you have those particular symptoms, then it's pretty clear that it's FIP. But FIP can look really like anything. So that's the hard part. Since it is something that virus has an affinity for these white blood cells, it can go to any part of the body. Unfortunately, there's not one single test that will
Right. That's what
diagnose
I was going to
FIP.
ask. Yeah.
Yeah. And so it can be really hard. Like I said, there are those classic presentations, which I think every vet has seen.
Hmm.
And unfortunately, for a very long time, like up until 5 years ago, if you diagnose that, then those cats would die, which is absolutely devastating. And so one of the reasons that I wanted to talk about this is that, like, within the last 5 to 6 years, there are treatments that are available, which is, we'll talk about that more in a little bit. And so now we are seeing really amazing success rates with treatment.
Right.
But so going back to that whole testing question, when you don't have a classic presentation, then it can be really hard to diagnose FIP, and it can look like a bunch of other things. It can look like, gastroenteritis. It can look like fungal disease. It can look like toxoplasma. So there are a bunch of different other things that it can potentially mimic. The American Association of Feline Practitioners, which I am a member, and I believe that you
Me
do a lot
too.
of their,
Yes.
yeah, yes, we love very much, and is an excellent resource for cat owners and for vets. They and another group called Every Cat, which is a nonprofit foundation. They actually do a lot of funding for research,
Hmm.
and is also an amazing resource. The two of them put together guidelines for veterinarians on how to diagnose FIP. And one of the things that's a little bit depressing is that they created these guidelines, and with FIP, the diagnosis, the way they call it is, it's brick by brick. So
Hmm.
there's not that one test. You have to take this test and that test and this test and that test, and you have to form a picture that gives you a sense, is this FIP or is this something else? And
Right.
so it can be really challenging. And what I would recommend is, if you have a cat that's sick and you're having a really hard time coming up with a diagnosis, then make sure that your vet does, have those guidelines, because they are free and available for every vet, and really understand what it might take to be able to diagnose, because it can be very frustrating for those cases that are really unusual. But I think that's one of the hard parts about FIP, is that it really can look like everything.
Right.
And, again, I'd like to reiterate that not every fever is FIP. There are a
Right.
lot of cats that can get fever, and, you treat them and they go on and they do great. So
Yeah.
that's important to know.
Yeah. I mean, in my own experience, thankfully, I've never seen a case of FIP, which I can't believe in all
I
these
know,
years
that's
of working
amazing.
with cats.
Yeah.
But I have seen, as you know, I've seen many cases of incredibly high fevers, like 107, which is super high for anyone. And then it ends up being a form of calesi, usually walking calesi, or limping calesi, not walking calesi, limping calesi. But some form of calesi virus, which has given many cats a crazy high fever and gotten them a hospital stay. So that's very true. I feel like I read something in doing research for this episode about PCR testing that is relatively new, but possibly not super reliable.
Right. So if you do have a cat that has a fever, it is a good idea to do an infectious disease panel. So looking for things like, have they been exposed to coronavirus, which is not diagnostic, but it tells you whether that's a possibility. And so a good example is we have a kitten that we saw recently that had a fever and was negative for coronavirus. That rules out FIP as the cause of this fever. So that's, fabulous. If you get those results, that's really great. But you're also looking for those other diseases. So feline leukemia, FIV, toxo, and basically just trying to put together a picture. The PCR tests, unfortunately, you have to have the right sample for them. And so, if you can get a fusion, if you can get that fluid that's building up in places where it shouldn't be, then you can do PCR on those. They're not perfect tests.
Sure.
There are labs that are working on testing, and so I think right now Kansas State University, there are vets there that are working really hard on developing tests that like one test that you can do that says this is FIP or not. But right now, it really is trying to get a full picture. And unfortunately, the only way you can confirm FIP is post-mortem, which you don't want to have.
You don't want to do.
Obviously. Yeah, exactly.
I have another question, and this is probably just a dumb question. But if you have a cat, let's say like Mimi, who's immunocompromised, who has like a not good immune system, and you want to do the PCR test, is there a chance of them popping negative on the test for coronavirus because they're not able to build a robust immune response?
That's actually not a dumb question because I don't know the answer.
Well, we're both idiots.
I guess if it's negative for coronavirus, then she doesn't have FIP. I guess that's the answer. FIP is not like herpes that you live with it forever.
Right.
And so, if it comes back negative, it's going to be negative. I guess that would be my answer.
Okay.
Yeah.
So they're not testing, this is my ignorance about how these tests work. They're not testing your body's immune response to say whether or not you've had it.
Right. That's right.
Okay.
Yeah.
That's what I was wondering.
Yeah.
Okay.
So it's not like titers for that.
Got it. Okay.
Yeah.
Thank you. But kind of piggybacking off that question, and then I'll let you get back to just going on your very excellent and smart rant about FIP. That's what we'll call this episode. It's just ranting about FIP. Right. So my other question was, you have talked about it really being a disease that we see a lot in younger cats. Is it a disease that you have seen in older cats, and that
older cats can get affected as well?
Okay.
Yeah. So and I think that's one of the things with. There are populations that are most at risk, but there are other animals that will fall outside those risk categories.
Right.
And so it is certainly something that you can see in older cats. I have never seen a mature cat, like a geriatric cat that has had FIP. And so when I say older cats, I'm still meaning, young adulthood. But usually after a certain period, I really haven't seen any old cats that get FIP.
Okay. I think I'm always thinking with Mimi in mind, our 13-year-old medical mystery cat
medical miracle.
Yeah, medical miracle is really true.
Lived well beyond all of our wildest expectations.
And that's the reason I was late to this taping, because she has developed a horrible habit of in the middle of the night knocking everything off of our nightstands, and just because she wants attention, and she's making us all insane because she's just feeling so great. She's like, woo!
Good for her. Everybody get up.
Yeah, she's being a real bee, let me tell you. But so my question was, is there is that a cause for concern at some point? Could a cat like Mimi, who's 13 and has immune
Mm-hmm.
system problems and all these other comorbidities, is that something that I would also need to be concerned about, or listeners would have to
Yeah.
be concerned about in their geriatric cats?
No,
Okay.
I've never seen that. Yeah.
Okay. All right. Back to you and what you were saying.
So we were talking about testing and how hard testing can be.
Yes.
And now I want to talk a little bit about treatment,
Okay.
which is the really, really exciting part. Oh, I guess one of the things that's really important to say is that if a cat has that mutated form of FIP, it is not transmissible. That FIP is not transmissible to other cats in the household. They can have coronavirus, and it would have to mutate independently.
Got it.
In each individual. So that's, I think, hopefully will make people feel better. Yeah, exactly. That if you have a cat with FIP, you don't have to take that cat out of the household. I mean, you know, the other cats are not going to get FIP from that cat. They could potentially get coronavirus from that cat. But so it's kind of interesting. And the only reason I bring that up is because actually in Greece, in Cyprus right now, you know, they have all those colonies of cats.
Mm-hmm.
Very recently, there has been that particular thing of it not being infectious has changed. And so they're actually now seeing infectious FIP, which is really scary. So there are cat researchers who are on top of that. And that's because coronaviruses, as we should all know, they mutate and they do weird things. And so I think that's something that we should all probably be keeping a close eye on. But so that's in Greece. And so now we'll talk about treatment, because it's the most amazing thing. I didn't start hearing about treatment until about 6 years ago, when somebody brought their Abyssinian in, and we diagnosed the Abyssinian, little beautiful kitty with FIP, absolutely heartbreaking. And they did their research. They went online. You know, basically, my understanding was that there was no treatment. There was, you know, this was a fatal disease, and this was just tragic news that I had to pass to these owners. And they found a group on Facebook that were talking about treatment. So a little bit of background, UC Davis, there's a lab, and Dr. Niels Peterson, who's a vet and a virologist, has a research lab at the vet school there, has been doing research on antivirals in cats with FIP, and that's been going on for a while now. And so he was the first to show that antivirals actually do work on FIP. And so, in fact, I think one of the first medications that he was working with, it was remdesivir.
Oh, yes. Yes.
Which is something that we use in COVID for humans. And then around the time, I think it was in 2020, the FDA took that away from them because they needed to have emergency stock of it for treating humans with COVID. But that was one of the first, really successful treatments. And so once his research started to get out there, people really, common citizens, not veterinary, staff, not doctors, but just people who had cats, who loved their cats and didn't want them to die, found each other and then found how to get these antivirals, which is kind of amazing. So just to kind of go through them. So there's that one, which is one of the first ones. These all have letters. So remdesivir is GS5734. And the number is, I think they're all made by the same company. So it's Gilead Sciences. And I think these are just the numbers of these antivirals. That's the company that has developed these. And so when that became unavailable, the lab at UC Davis started to use something called GS441524, which is the one that is the most available and the one that everybody has been using. So these drugs, besides the remdesivir, they were not FDA approved. They haven't been FDA approved. And so trying to get them has been challenging. Veterinarians are not allowed to prescribe them. They're not allowed to recommend them. That's against FDA regulations, and you can lose your license if you try to prescribe them. And so people, common citizens, they did their workarounds, and even though it wasn't being manufactured for release in the United States, people were finding places in China, India, that were making these antivirals, and a whole black market developed, and a whole network of volunteers and people who had to go through this, developed ways to purchase this medication and make it available to owners to do treatment on their own, basically, which is amazing. I mean, I think it's one of the best case scenarios for social media. You know, like everybody always complains about social media, but it really can do miraculous things. And this is one of them. This is like the best possible thing. And so, if people are on Facebook, there's FIP Warriors. It's one of the ones that I was first introduced to. And if you have a cat that you want to start treatment with, you can contact them. They will link you with a volunteer who will then walk you through all the steps and help you with, you know, what you need to do, monitoring, treatment, find dosing, find supply. And so, you know, thousands of cats now have been treated and have lived, you know, whereas before it was a 99.9% death rate.
Right.
Now we're seeing something close to like a 90% success rate with these medications, which is amazing. It's amazing. Not every animal will survive. Some of them you can't take them off of the medications, but they're out there and available. And one of the things that's actually really interesting is you hear black market, at least I hear black market, and I'm like, oh my God, like that sounds horrible.
Right.
What are you going to get? You're going to get like flour and who knows? But studies have shown that there have been people who've studied the supply chain, and the medications, the antivirals, are actually pretty pure. So the 44, 15, 24, which is the big one, all of the samples that were tested in one study were exactly that. And so it's kind of nice that, that there has been, for one thing, people checking, doing quality checks.
Of course.
But also that it seems to be what, they say it is. And so there are a couple of other antivirals too. So that's also important to know. Paxlovid, everybody knows about Paxlovid for COVID. Mm-hmm. That's actually a little bit too toxic for cats. And so that's not something that actually is available. But the 44, 15, 24, which is the most common, can be very effective. It comes as both injectable. So initially, I think all of these medications were just injectable. Mm-hmm. And I think, the hard part about these is that the medication itself is very acidic, and they have to be injected, and they can cause a lot of pain, and they can cause skin issues. And so, it becomes a benefits risk type of analysis of, if you save your cat and it has some skin lesions from time to time, trying to decide what makes the most sense.
Right.
And people who are treating their cats can go to their vets for follow-up. And so this is, again, this is how I was introduced to all of this, is having this person come with their cat, and I would help with the blood work, and I would help with, there were other, at that time we were doing other supplement type things and helping for them to order the supplements, and treating the skin issues when the skin issues arose. So things like that. So your vet is not completely useless in this, but they're limited in what they can do. One of the questions I think that people ask, and I think this is the biggest question, is why are these not FDA approved, and why can't we use them? And what's happening with that?
Right.
So the most recent information is that Gilead Sciences, they're not going in this direction. As far as we know, they're just really not interested in developing these into veterinary products. And news sources that try to get them to comment, there's no comment. I think that one thing that I read is that they may be nervous about the possibility of adverse effects, which would then affect their ability to use it in humans. So that's one possible theory, and so they kind of don't want to open up that can of worms. Remdesivir, which is FDA approved. So one of the things actually that's very interesting is now that it is no longer considered an emergency drug just for humans,
right,
it actually can be available for vets to use off-label. And so this is actually one of the things that I think is really interesting, is that most vets don't even know that that's a possibility. And so, for the most part, most vets just think there's nothing that I can prescribe. If you're able to get it, you can prescribe it as an off-label use. That actually is FDA okay. And so the Veterinary Information Network, VIN, is one of the news sources that vets use. And they have an entire article about trying to make that better known among veterinarians. But it is still very hard to get your hands on, because it is primarily only in human pharmacies, and human pharmacists may not want to allow it to be scripted out by vets.
Right.
So that's one of the challenges. Kansas State University is currently working on something which is a GC. It's not a GS. It is GC 376. And so they actually are working with a veterinary biotech company to get this license. And it's another antiviral that seems to have to show promise. And that is something that we're hoping by 2026 will be available.
Oh, amazing.
Yeah. Yeah. So there are things that are in the works. But, the most important thing, the thing that I hope is the takeaway, is that if your cat has FIP, there are potentially options.
Right.
The injectable version of the antiviral, there are also oral versions, and so it's not always just injections. I think with the oral medication, there can be GI upset, so there's always
right.
Decisions to make, and it may not be as effective, but for some cats, it makes a big difference. So
sure, Well, that's all great to hear, except for that company is not interested in pursuing.
Yeah,
that's frustrating.
I mean, it's frustrating that there is not really even any statement by them. They're just kind of like, we're staying out of this. Do what you will, but we're not. This is our thing.
Rude.
So, it's hard. It's hard, but there are a lot of groups out there that are still plugging away, doing the research, working on testing, working on cures, and I'm really excited and confident that if within the next couple of years there's going to be something available, and we'll be able to see a much better outcome for these cats.
I hope so, but I think it's great that, like you said, that social media, that people are being so helpful. That reminds me kind of how during the beginning of COVID, people on social media, at least in New York, were so helpful about sourcing appointments for people for vaccinations, and it actually was being used in a good, kind way versus how it can
there are
often
definitely
be used.
Good people out there, and like-minded people who love their cats, know that relationship between humans and cats and how strong that is, and want to help.
Right.
So which is great.
So when cats are on this medication, I know you said some of them may have to be on it long term. Is there an average amount of time that cats generally have to be on medication?
It's usually, I believe, 12 injections.
Oh, okay.
And so it's usually 12 injections. There's dosing for the cats that don't respond initially to the first medication. This is one of the interesting things, is that the remdesivir may be more effective, and so trying to get that available, trying to get your vet to see if they can get a hold of it, can help to improve their outcome. But it's usually a set time, and I've seen cats that have had to use it for longer, or had to adjust and go to a different antiviral. The cost for this is around $5,000 to $6,000 for getting the medication and treatment. And then I think that's just for the treatment, and then that doesn't include your testing and follow-up. And yeah. Okay.
Well, that was a very robust backstory on.
Were there questions that?
Yes, let me go through them. One of our listeners submitted questions, and a lot of these came from listeners who actually have dealt with FIP in their cats successfully using the medications, and so they're just really curious about your take on a lot of this stuff. One of them is, how do you feel about vaccinations in cats post-FIP? And I assume they're talking about FERCP, rabies, the typical vaccinations that we're giving cats.
Yeah. During treatment, we don't recommend it for sure, because you want a really robust immune system, both for vaccines, but also for treating FIP. So I wouldn't recommend it. You could consider doing it for cats that are high risk for those things. So if you have an outdoor cat and there's the possibility that it could get rabies, then you probably want to vaccinate it once it's in the clear. If you have a cat that, and this is, I think, true for a lot of cats, it kind of depends on the risk. And there are guidelines, again, by AFP. You know, if the risk is low for certain cats, I don't know that I would necessarily vaccinate. You know, if they're indoor only, they're not around any other cats, you know, nothing else is going on, then you could consider withholding vaccines, kind of depending on how they're doing.
Are you seeing more cases of FIP about the same? What is your experience? Okay.
Yeah, about the same. So definitely something that's not uncommon. You wish it were more uncommon, but, you know, I would say several cases per year. Okay. But, you know, the good news is that so many more of them are now post-treatment.
Right.
And that's like amazing.
That is amazing.
Really amazing. Yeah.
What are your feelings about there being some kind of trigger, like stress? I know we kind of talked about this a little bit, but
yeah. And so that is a factor. So that does seem to be something that that the cats that do develop FIP, they have experienced stress. And I think that's a hard one, because not everybody recognizes stress in cats. And cats are so sensitive that, you know, what you don't necessarily think of as stressful may be stressful. So, yeah. But yes, that is a factor.
Okay. And stay tuned, everyone, for an upcoming episode with me and Gina on cats and stress. I really do think that it's a really good topic. And thanks for coming up with today's topic and the next topic. You're my unofficial producer, I think, you know, to talk about.
Yeah. Well, the funny thing about cats, here's my opinion. Cats with stress, that to me, like, and I think this is why it's so hard, is because you see a cat that's curled up in a little ball in a beam of sun, and you think, what could be less stressful than the life of a cat? And, you know, when I was in vet school and working my brains out, and I would see my cat just sleeping away, I was like, why are you living this life when I'm so stressed out? So I think that, you know, it's really easy to think that their life is so cushy and they've got it made, and, you know, you're basically their servant. But it's true. I think you'd be surprised about what can be stressful to a cat.
Yeah, they're hypersensitive. They're really hypersensitive animals, and and I think because they're predators and prey, that drives a lot of it.
Yeah.
But we'll save that for our next episode. Okay. getting into the nitty gritty of that, because I have a lot of thoughts on cats and stress also, and that driving a lot of disease and issues.
Yeah.
Okay, so we talked about this. Can my adult healthy cat come down with FIP at any time?
It's not likely.
Okay. Yeah. All right. Not likely. That's good.
Well, yeah, you know, it's the risk is low if it's otherwise been fine.
So that wraps up our FIP related questions. One of our non-FIP related questions is, can a cat with FIV live with other cats who don't have FIV without transmitting it? Is it safe? I can just say from my own experience, having had several cats with FIV, first original Marvin, who you may or may not have met. I don't know if you...
I don't think I did.
I don't think you ever met her, but she was great. She was an NYC street cat who just walked into the house one day and never left. She had FIV, and despite actually having a serious fight with, if you remember, Emmy, with one of our older cats, did not transmit it. And FIV is transmitted just like human HIV is transmitted, right? Blood to blood contact. Saliva, it's not really saliva, but saliva.
Yeah, so bites.
Yeah, bites, right?
It has to be a bite. Yeah.
Like a deep bite.
It's not from grooming. Exactly.
Yes.
So, it has to be saliva to blood.
Yes. Yeah. So I was really concerned with that, but thankfully she never developed anything. Yep. And now we have Kevin, who is, you know, our big unit, Kevin, and he has FIV, and we have 10 other cats, and we are not concerned at all.
And he has no teeth as well.
He has no teeth, so he's tooth optional because he did develop stomatitis because of the FIV.
Because of the FIV, yes.
But yeah, it's not a concern for us, but perhaps you could speak to that a little bit just about the transmission.
And so if you have a multi-cat household, and one of them turns out to be positive, if they live in relative harmony, then the risk of them catching or passing on the disease is pretty low. So it's not something that lasts in the environment, and it does have to be bite to blood. There is a vaccine available for feline leukemia, and every young cat, every kitten should start with a feline leukemia vaccine, and then hopefully at some point it will become completely moot and we won't have to worry about it.
Right. Agreed. I haven't had a senior cat in years. What should I look for now that my baby is turning 8?
I'm going to say you have 2 more years before your cat is a senior.
2 more years before they get their AARP card. Yes.
Exactly. We're going to push that back a little bit. But we talked about this in the last podcast is, just making sure that you're monitoring for the usuals with your kitty, taking them in on a regular basis to see the vet, having blood work done, monitoring for appetite, for their usual behavior, making sure there's no changes in their behavior. All of the stuff we had talked about before.
Okay. Do they need to think about switching to a different food? I know there's always a lot of marketing about food for seniors. Is that something that people need to think about?
So food for seniors is actually not hugely different than food for adult mature cats. A lot of those foods will have extra joint supplements or fatty acids or things like that, but the nutritional content is still the same. They can be calorie reduced for those cats that just become much less active, and so kind of depending on your cat's body weight, if your cat is a little bit heavy, then it might make sense to go ahead and switch over to a mature geriatric food, but not necessarily. It just kind of depends, because it's not their life. They're the age brackets for food. So kittens, there is a kitten food, and then it's not like there is a specific geriatric food guideline. Just FYI, those foods are. It's like kitten food and then adult food. So
okay. And then sort of going along with that, what supplements have good evidence base for supporting joint health in older cats? I know the answer to this, but
it's a good question because a lot of people don't know this. And I learned this from continuing education. Cats don't really respond to glucosamine and chondroitin supplements the way dogs and humans do. And, that's also somewhat variable, but cats respond much more to concentrated fatty acids, so the marine fish oils, and specifically to the green-lipped mussel. So what I generally recommend for cats is Antinol, which I believe you have your kitties on.
Yes, I sure do. Yes. And I have, again, Antinol is not sponsoring this. I wish somebody
would. And I don't get any money from Antinol either.
I'm sure we would both love to get money from places, but no one's giving us any money. No one's giving us money. But Antinol is amazing. I gave it to Steve. I noticed huge difference after 2 to 3 weeks in the cats, the senior cats. When I started giving it to them, I started giving it to Mimi, and she hadn't played in years, and she became insane, and just started playing and running around and slapping people. Just really being her old dominant self. So I can't say enough good things about it. The only thing is that it is in a pill form, which can be a bit rough for people.
Isn't it a capsule?
It's a capsule. It's a little capsule, but
you can. So, and I was going to say this because it's a little capsule with oil in it. So if you can't pill your cat, you can pierce the capsule and put the oil on the food, which is what I tell people.
Okay.
So it is, because it's tiny. It's a tiny capsule. It's not a huge amount, and so it should be relatively easy to hide that into food if your cat is picky.
I will say also it is very stinky, because once it arrives smashed,
it is super stinky
at our house. It came in the mail and it was all smashed, and I was like, it was. It was
Yeah.
rough. It was for
Yeah.
a vegetarian. I was like, hey, what is
Disgusting.
this?
Yeah. Yeah.
Thankfully, the Kevin and Mimi are both good pill takers because they have to take so
Good.
many pills every day anyway. But it's a great supplement, and I think for people who can't for some reason give that, like there is that Super Snoots green lipped muscle powder that you can sprinkle on stuff, and that I have noticed cats just love eating that. It's a great like little topper that I've used to put on food, especially when Mimi doesn't really want to eat, because she'll go through these periods of being inappetent. And so that has also been good. Before we learned about Antinol, that was a really good thing to use for arthritic cats for joints. Okay, please discuss dental work. Do water additives really help?
So, they can help a little bit, and it depends on the water additive you're using. So, to find the best products, the products that really do work, you should go to the Veterinary Oral Health Council website. So, vohc.org. It is a nonprofit group of, I don't know who they are, people who are interested in this kind of thing. They evaluate all of the dental products on the market, veterinary dental products on the market, and test to see which ones work and don't work. So they're not funded by any of these companies. It's an independent group, but they have product lists of all of the dental products that they think work. So, and they have, it's a really excellent list. So vohc.org. So, water additives do a little bit. Brushing is definitely the gold standard for dental care, but not everybody can brush their cat's teeth. It's really hard.
Oh, that's
And
tough.
so
That's
really
it's a tall
tough.
order.
It's a tall order. And the truth of the matter is that cats unfortunately get a lot of disease below the gum line. And so even brushing, the treats, the foods, the various things that are out there for their teeth, doing cleanings on a regular basis is definitely recommended. And the AAFP, again, back to our association, American Association of Feline Practitioners, they recommend that cats start having dentals by 1 year and have them yearly, because there really is so much that's going on in the mouth that you can't detect unless you take x-rays, unless you're doing really thorough exams. So if you want to save those teeth or keep your cat as comfortable as possible, that would be the big recommendation. It's interesting because there are cats that have stomatitis, like Kevin, and then there are cats that just have gingivitis.
Yeah.
And so the cats that have gingivitis, doing dentals on a regular basis can make a big difference for saving those teeth.
Right.
Some cats, though, they just don't want to have teeth, and you end
up,
having to pull them all at some point anyway. And as you know, and this is a big, most people don't realize this, cats do absolutely fine with no teeth.
Yes, they do.
I think a lot of people are very nervous about the idea of their animals having extractions, but the pain that diseased teeth cause is not worth keeping those teeth in.
Agreed. And I've talked to a lot of Steve's followers who write me because they know that, Kevin and Mimi don't have teeth because they see them all the time with their open mouths and no teeth. And then they're saying, oh yeah, I'm supposed to get all my cat's teeth extracted, but how do they eat, blah, blah, blah. And they don't realize that cats don't actually chew very often, that they're just throwing the food back.
Yeah, especially when they have dental disease. I think people don't really realize they are not chewing with those teeth. And so, over and over again, I have had clients that have been in shock and horror when I say, we need to take out all of these teeth. And then 2 weeks after the dental and those teeth are gone, they say it is night and day. Yeah. This cat is now happy. This cat, who I thought was just a quiet, a little shy cat, is now a brand new cat. And I hear it enough that I really believe in it.
Well, and it can cause aggression too, right? So it doesn't always,
it's chronic pain.
Yeah, the pain doesn't always just result in like a quiet cat. I will say in the case of Mimi, who's always been a little bit strident in her attitude, she was really, before we found all her disease, she had stomatitis too, didn't she? You took out all her teeth.
I think she just ended up having bad teeth. Yeah.
Because she was still quite young when we did it. But her attitude change within 2 weeks was also crazy. like
crazy.
crazy to
Yeah.
see, you know, that she was nice to Allie finally. And she was like, didn't slap everyone in the face right away. You
Uh-huh.
know, it
Yeah.
really
Yeah.
does make such a big difference. And I don't think, you know, again, I think we've talked about how cats hide pain really well, but I do think that dental pain is such a big deal for them. I think for anybody, like if it's pain in your head,
Oh
it's
yeah.
so hard to
Oh
ignore.
man. Yeah,
Like,
for sure, for sure.
yes,
Yeah.
so I
Yeah. Yeah.
definitely agree with the yearly dentals. And to that end, people getting a good insurance plan that will cover that
Yes.
is
Uh-huh.
really important, because dentals are so expensive. And then
Yeah.
once you start
Yeah.
moving into extractions, and especially if you have
Mm-hmm.
multiple cats, it's
Mm-hmm.
very, very worth it. We just talked to one of our good friends through looking at different plans and you
Mm-hmm.
know, explaining, well, you may need to do this down the line because their cat's a
Mm-hmm.
senior, and
Mm-hmm.
definitely get a plan that has dental included, or at
Mm-hmm.
least extractions included.
Mm-hmm.
I think that's really important for people to
And I
do.
think an additional comment is that it's good to do it before the dental disease is
Oh,
actually apparent.
yes.
Because with insurance, with pet insurances, if they have a pre-existing condition, they are not going to cover
They
that.
won't cover it,
And
or they won't
so,
even take you.
yeah, exactly. They want to take it. So don't wait
Yeah.
until your vet says that your cat needs extractions. You should do it before then, so that it gets covered.
Yes.
Yeah,
Agreed. Agreed. Okay.
yeah.
And the last question is, when do you say it is enough meds? Let's say your cat is on 6 meds. Like, how far do you take it with meds? And I can give my answer, but let's start with your answer, Gina.
Yeah, and when we had talked about this question, I think this is really hard because, and especially later in life when our kitties and our dogs, this is true for all animals, as they're getting older, it may be you have this pharmacy of medications that you're giving. My rule of thumb is it improving their life and improving their quality of life? Or are you wrestling so much with giving these medications that that's ruining their life? Because you'll have both cases. And so it has to be an individual basis for each animal, and you have to know your animal well enough to know what makes sense for them. So, if they take their medications relatively well, if you're not stressing them out so much that they're hiding from you, and you're seeing benefits from those medications, then, there's not really a limit to how many you can give them. I know it gets really hard and you end up like feeling like, you have a hospice or you're this constant caretaker where you're doing all these things, but you really have to weigh the benefits with the cons of it. And if your cat tolerates it, and again, if you feel like they're benefiting, then to me, it would be worth it. If your cat hates you and hates life and hates all of the handling, you may end up feeling like it's not worth it to do, understanding that your cat may not have as long a lifespan, but at least when it's with you, your cat is actually happy. That's okay. It's all personal choice. It's, cat individual, but that's basically my take on it.
Yeah, I agree. I think quality versus quantity is a
Yeah.
really important decision when you're talking about this stuff. And I think it also depends if you're talking about chronic illness versus kind of an illness that's going down, like cancer,
Yeah.
like we dealt
Yeah.
with Steve, where I pulled
Hmm.
him off some of his medications that were just
Yeah.
not helping
Yeah.
him, that may have extended
Hmm.
his life, but we're just
Right.
not making
Yeah.
him feel good. So it was like, what are we
Yeah.
doing?
What are we
Like,
doing? Why
what's
are
the
we
point of
doing
this?
this?
Yeah, like let's
Yeah.
just have him
Yeah.
have more good days, even if it's less
You
days in
know,
general.
the hard part is that you don't necessarily always know which way it's going to go.
Right.
So not every cat reacts to every medication the same way. So it really has to be something that you experience on your own. And so sometimes there are medications that, somebody else's cat may have found it very toxic, but your cat may tolerate well.
Mm-hmm.
To me, it's worth it to try to see how they are at taking medications and to see how they respond to it before making a decision. But I wouldn't tell somebody to keep going if it made their cat miserable or if they were it ruined their relationship because they can't give it.
I agree. And I often, in my own practice, when I recommend medications that are, again, these are behavioral medications and I can't dispense them, I'm not a vet, I have to
Mm-hmm.
work with the vet, right?
Mm-hmm.
I just like to say that because I want everyone to know I am not a medical professional. I'm just a behaviorist. But I really like to recommend that, especially when people are using these behavioral medications like fluoxetine, they do a transdermal ointment application, right? Because it makes it a lot less stressful for everybody. And I think especially with behavioral medications, if you're chasing a cat around to give them a pill or a liquid,
right,
you're just compounding the problem, right? Because you have a stressed out cat that you're trying to make less stressed, and now you're chasing them around every night at the same time, probably to give them a pill. So now your cat is like waiting for this predictable, terrible behavior and getting more stressed, and it just doesn't work. So I think medications that can be compounded in a way so that they're either more tasty or go on the ear, or, you know, or just given in a way that may be a little more costly, but are friendlier is great if that's possible, if it's feasible. I know you can't do that with all medications, but I think a decent amount you can at least make taste less horrible.
Exactly. If not, if it can't be given transdermally, you could get it into a flavored liquid or a flavored tab. They do the microtabs. There's all kinds of ways to give medications these days.
All right. Well, thank you so much, Gina, for appearing on this episode.
Always a pleasure.
It's always a pleasure to have you. I'm always so happy to talk to you. And I'm so grateful that you have been on this episode to educate all of us about FIP. And yeah, that's it. I don't know how to wrap this shit up. Wrap it up.
I think that was perfect. That was perfect.
Thanks for watching. Hiss and Tell is a subsidiary of my cat behavior business, Cattitude Adjustment, and that's our channel name on YouTube, which is where you've watched this video most likely. If you'd like to engage my services as a cat behaviorist, you can find me at cattitude-adjustment.com. Music is generously provided by Cat Beats.